Okay, so once you've healed from the surgery after 2 or 3 months, if the incontinence isn't getting better, it's time to do a preliminary evaluation to see why. Remember, we said that almost always the problem is the sphincter muscle being not working properly, but we want to check that out for sure. So what we'll ask you to do is to keep a diary for 24 hours where you record the time and the amount of each urination, and to also wear your pads as you usually do. Bring them back the next day to the doctor's office, and then the doctor can just look at them or even weigh them and weigh a dry pad and get a sense of how much urine you actually lose. Then the next thing he's going to want to do is to examine you with a full bladder. And when he examines you, he's going to ask you to cough and push down, and he's going to see if any urine leaks out. And if urine leaks out when you cough or push down, then that's a sphincter weakness. And that's present in about 95% of patients that have urinary incontinence after prostate surgery. But a small percentage, maybe about 5%, have actually a different problem. Their sphincter, it works okay, but the problem is that their bladder contracts the bladder contracts involuntarily. That means that you actually start to urinate without control. And it's very, very important to make the distinction of which these things are. Because if the problem is urinating without control, due to what we call involuntary bladder contractions, that may be paradoxically due to a blockage. So it's possible that the surgery worked well to remove the prostate, but you're left with a scar that causes a partial blockage. You can still urinate, but that blockage then causes the bladder to contract involuntarily. So at this period of time, several months afterwards, depending upon which of the two abnormalities you have, and it's possible to have both, the doctor could institute some kinds of preliminary treatments. We don't really do anything, we don't even consider surgery at this stage, but based on the bladder diary and your underlying, and whether or not you have these involuntary bladder contractions, it might be reasonable for you to use some behavioral techniques to try to improve the continence. Then over time, we expect the continence to get better. And by 1 year after the surgery, we expect that at least 90% of the patients will either be no longer incontinent or so much improved that they don't feel like they need any further surgery. If you're one of the unfortunate ones in whom the urinary incontinence did not get better, then it's time to consider treatment options, more permanent treatment options, and those options are basically surgical. And the surgery falls into two kinds: an artificial sphincter or a sphincter prosthesis, or what's called a sling. The sphincter prosthesis, without getting into all the details, simply replaces the sphincter with a plastic-like device that's completely implanted within your body, and that works very, very well. It's been time tested, but it's a mechanical device. The sling operation is a much newer procedure. It's made of different kinds of mesh, and the sling actually puts this mesh or this synthetic tissue underneath the urethra. And the idea is that when you cough or move about, the urethra gets actually compressed by the sling. That's a much newer operation. In my own judgment, the sling operation, although it's done very commonly in this country, is still a little too new for it to be adopted as widely as it has been. The way it works is we put this tissue underneath the urethra, and when the patient coughs or moves, it compresses the urethra. And it's effective in a certain percentage of patients, but again, in my judgment, not nearly as effective over time as the artificial sphincter or sphincter prosthesis is. If you're considering one of these operations, it's really important that you ask your doctor the pros and cons, and that you and he or she make a decision based on what's best for you. Because in some patients with mild incontinence, the sling actually may be a reasonable option. Now, the other cause of incontinence only accounts for about 5% of patients are involuntary bladder contractions. And in that case, what's happening is you're simply urinating without control. There are some important causes of that need to be ruled out before any definitive kind of treatment is undertaken. And the three most important causes of this overactive bladder incontinence or incontinence due to involuntary bladder contractions are a blockage due to a scar from the surgery, bladder cancer, and bladder stones. So these things need to be checked out first, and then if they are found, then they need to be treated. If they're not found, then you'll embark on a treatment for the involuntary bladder contractions, which can range from behavioral therapies based on your bladder diary, or medications, or sometimes electrical stimulation or neuromodulation. There's a number of different modalities that can be effective for this urinary incontinence due to involuntary bladder contractions.